Funding for AARP Alaska comes from the State of Alaska Division of Banking and Securities, Senior Citizen Support Services, and AARP. In today's program, we'll learn all about Medicare Parts A, B, and C. Now here's your host, Ann Secrest.
Hello everyone and welcome to AARP Alaska. Today our guest is Jeanne Larson, Health Program Associate with Alaska's Medicare Information Office. Jeanne, thanks so much for being with us again today. If you would, tell us a little bit about yourself. How long have you been with the Medicare Information Office?
Well, Ann, I've been with the Medicare Information Office the longest of any employee. It's going on 9 years now. And I am grown and raised in Alaska, so I'm Alaskan and serving Alaskans with their Medicare questions and concerns. And I have an insurance background, so I speak insurance and help people navigate and understand all the intricacies.
Well, speaking insurance is almost a foreign language for many people. It is. As we discussed in our first program, we discussed Medicare Parts A, B, and C, and in this program we're going to talk about Medicare Part D, the prescription drug benefit. Now this entire outreach is part of the Medicare Getting Started program. How would you describe that?
Well, Medicare Getting Started is a PowerPoint presentation that focuses on helping people understand the different parts, a very basic overview, when to enroll, what parts they may need based on certain circumstances, and the best time to do that to avoid late enrollment penalties and ensure that you have appropriate coverage.
Now, this first slide here, you basically have two programs under one roof, the State Health Insurance Program and the Senior Medicare Patrol. Tell us about the two programs.
Sure. Well, the State Health Insurance Program is also referred to as the SHIP program, and that is administered by the Centers for Medicare and Medicaid Services through a grant through the Administration for Community Living. And that's funding for our Medicare Information Office to empower, educate, and do one-on-one counseling for Medicare beneficiaries or their family members or caregivers. So we're basically helping people navigate Medicare and understand the different parts. We're a boots-on-the-ground effort. We recruit and train volunteer Medicare counselors, many of whom are located in other agencies around the state of Alaska. The second grant that our office is funded is the Senior Medicare Patrol, or SMP. And SMP is tasked with recruiting retired volunteer professionals to help empower people to understand and reduce and target Medicare fraud. And we try to do so within the Medicare program and the Medicaid program. So volunteers really being our one-to-one persons in their communities.
About how many volunteers do you have throughout the state?
Well, that can vary because volunteers come and go quite frequently. For the most part, we can have anywhere from a cadre of 35 volunteers to 65 is usually the normal number.
Excellent. Our next slide talks about the goal of your office. How would you describe the goal of the Medicare Information Office?
Well, we pride ourselves in being Alaskans, serving Alaskans with their Medicare needs. And we are tasked at helping people navigate and understand the many difficult processes behind Medicare enrollment. We want to empower them to understand when to enroll and help them make good insurance decisions regarding Medicare and other programs that might interact with Medicare.
Very good. All right, let's get into the meat of the program. We're going to start this program by first looking at Medicare Part D, the prescription drug benefit.
Medicare Part D, I always joke and say, is my favorite part because you can say D like drugs. And Medicare Part D can also be referred to as Medicare Prescription Drug Coverage, a PDP, which stands for Prescription Drug Plan, or Prescriptions. Basically, it's a private insurance company that's available to all people with Medicare. And these private insurance companies are approved by Medicare to administer just prescription drug coverage.
Right.
It's a completely separate part of Medicare, and anybody with Medicare is eligible for the drug coverage. It can come in a few different forms. Medicare prescription drug plans Part D are the only ones we see in Alaska and have for some time. But they may also come with Advantage plans. Part C, Medicare can also offer drug coverage. And then some people might actually have a drug plan that's sponsored by their employer. So maybe they have a retirement coverage that has a Medicare employer-sponsored drug coverage. So it comes in different forms.
All right, let's go to the next slide. How Medicare Part D works.
Well, it is an optional part of Medicare, so not everybody possibly needs a prescription drug plan, and not everybody wants to enroll in the drug coverage. It just really depends on if you want assistance with paying for your medications. And if so, and you have no other coverage, then enrolling in Medicare Part D is ideal. The plans are required to cover a certain classification of medications. There's about 7 classes of medications that Medicare requires to cover. And then from those classifications, the private insurance companies can pick what kind of medicines they want to put on their formulary, their list of covered drugs. And then each of those different formularies can include a range of those different categories. So several drugs in a particular category, such as an anticonvulsant or a cholesterol medication, those kinds of things.
All right, let's, now people pay a monthly premium, you pay a deductible and a copay. Is Medicare Part D, does it work the same today as it did when it originally came about a couple years ago? Actually, no, it's several years, where you gather all your meds together, you sit down in front of a computer, you put in everything, and out pop several options. Is that summing it up?
That's the gist of it, yes. Medicare drug coverage became available in 2006 for the first time under Medicare. And it does require a person to pay a separate monthly premium, so an amount that you pay just to have the coverage. And persons can have that premium deducted from their Social Security benefits if they get Social Security, or they may pay the premium directly to their plan, either sending a check each month or having it deducted from a bank account. But yes, there is an additional cost. There's also costs under the insurance. When you go to pick your medicine up at the pharmacy, you might have a deductible with that prescription plan.
Right.
An amount you pay, basically the full cost of the drugs until you hit a certain dollar amount, and then you get the benefit under that insurance. And then after meeting a deductible, you might have a small cost share on that medicine, like a co-payment, a set dollar amount, or a co-insurance, a percentage of the full cost of the drug. And basically the only way to know what those costs are going to be is, like you said, getting your list of drugs, looking at all the different plan options, and trying to find the one that covers all your medicines and at the best cost.
And if I remember, it's so important to sit down with the actual prescription drug itself, not a list, but the actual medication, because knowing, just plugging in the exact dosage, just everything right from the prescription bottle itself is so critical, because it can change then the outcome of what is recommended.
That's correct. And there's actually quite a lot of help out there to empower people to do this on their own. There's a very user-friendly tool that we're going to talk a little bit about.
Good.
And there's also local help. There's usually the Medicare Information Office call center, which is my office, and also our many volunteer counselors that can help people go through their medication names, the dosage, and the quantity they take each day. And that information is best to get an exact price of the different plans available.
All right, let's take a look at the next one, is who can join Part D?
Well, anybody that has any part of Medicare can join. So you can have Part A, hospital insurance only. You can have Part B, medical insurance only, or you can have both Part A and B. And you do definitely have to live in the United States. Medicare does not work outside of the United States, so you have to make sure that you are residing in your plan's service area. You also have to make sure that you're not incarcerated, because Medicare drug coverage also does not work when you're incarcerated. And you do have to make sure that you actively enroll in the drug coverage. So for most part, it's not an automatic enrollment. Once you have Part A or B or both, you have to take action and sign up for a Medicare drug plan to secure that coverage as well.
Got it. And when can a person enroll?
Well, that's a great question. The best time to make that consideration is when you're newly eligible for Medicare, and that's a time during what is called your initial enrollment period. That's the 7-month window that for most people is when they turn 65, their 65th birthday month, the 3 months before their birthday month, and up to 3 months after. That's the initial enrollment period, the time to really start looking at, do I need a Medicare drug plan? There's also different times that a person can enroll in drug coverage as well. So if they miss the initial enrollment period boat and have to wait later, there is an open enrollment season every year, October 15th through December 7th. And that's also the time that persons who currently have a drug plan can reevaluate that coverage, and we do recommend the annual review. And if you enroll in drug coverage during that time or change your drug plan during that time, the new coverage becomes effective on January 1. There's also some special enrollment periods, some special exceptions to enrolling in a drug plan or switching your drug plan. If you move out of the plan service area, so maybe you retire from Alaska and move to Florida, you would have an opportunity to reevaluate because there might be different plans in Florida versus Alaska. Also, if you were working and you had health insurance through an employer and your employer plan ends, that would give you the opportunity to enroll in a Medicare drug plan. So different scenarios, different enrollment periods, and if a person wants to know when to enroll, my Medicare Information Office can help people know the right time.
If there's a change in health status, does that also qualify in?
Really depends on the change in health status.
Okay.
One special enrollment period would be is if a person moved into a long-term care facility.
Okay.
And that long-term care facility might have a particular pharmacy they deal with. Then that would afford a special enrollment opportunity. If you never took any medicines and now all of a sudden have great medicine needs, that would not warrant a special enrollment period. That's why making the right decision at the right time can really be valuable, because if you're left without drug coverage, then you're going to have a lot of out-of-pocket costs on prescriptions.
Got it. We'll be back with our guest, Jeanne Larson, right after this break.
Alaska's Medicare Information Office is Alaskans helping Alaskans get more out of their Medicare. They provide one-on-one counseling to Medicare beneficiaries and their families. They also teach how to spot and report Medicare errors, waste, and fraud. Call toll-free 1-800-478-6065 or in Anchorage 269-3680.
We're back with Jeanne Larson, Health Program Associate with Alaska's Medicare Information Office. And Jeanne, I would imagine for so many people choosing a Medicare Plan D plan, did I say that right? Choosing a Medicare Part D plan, there we go. Still a challenge for many people. We do have on our next slide some resources for people, but frankly, with all the talent that's in your office, I would recommend calling your office. The three of you are just wonderful, and with all the volunteers around the state, that's probably the best thing people can do here in Alaska.
Absolutely. It doesn't have to be a challenge. There is help available through our helpline, 1-800-MEDICARE, which is available 24 hours a day. But we like people to call us because we're Alaskans answering the phone. You don't get an automated system, and we may have a volunteer in the person's area in Alaska to assist them face-to-face.
That's wonderful. All right, let's get into three scenarios of whether or not should I enroll in a Part D plan.
Right. Well, the decision is going to be based on the particular individual's situation. Not everybody needs a drug plan. You have to consider a few different things. Like number one, if you have what's called creditable prescription drug coverage. That's any other drug coverage that's as good or better than what Medicare Part D offers. So if you have a retirement plan, you have an active health plan through work, if you have Veterans Administration, VA benefits, TRICARE, those are all really good drug coverages that match up to Medicare's. So you don't have to enroll if you have other good drug coverage. You don't need a Medicare Part D plan. And if that ever changed, you would get enrollment into a drug plan free of penalty through a special enrollment period. Another consideration is what if I don't have creditable drug coverage? If it's not as good as Medicare's, or you don't have coverage through your employer or retirement plan, you do want to enroll in Medicare Part D so that you avoid late enrollment penalties and you have drug coverage. Then you also have another scenario where if you were working but you retire and that coverage ends, then you want to enroll through a special enrollment period, and that's, you have up to 60 days to get into a Medicare drug plan to get that coverage through Part D. And then you have coverage start immediately.
Got it.
Another thing could be if your drug coverage was creditable, it was good, but then all of a sudden it was not as good as what Medicare offers. Then if you get advised it's not creditable drug coverage any longer, you get a special enrollment period as well. So again, you have to look at all those different considerations. Most important thing is, if you don't have any other good health insurance, you need to enroll during your initial enrollment period when you're new to Medicare, so that you have adequate medication coverage and you don't pay more money as a late enrollment penalty for not signing up when you were first eligible.
Got it. All right, let's talk about Medigap. What is a Medigap policy?
Sure, Medigap is the name that speaks to what's also referred to as a Medicare supplement plan. This can also be called a supplement or a med sup. This is private insurance that's approved by the State of Alaska Division of Insurance. So it's private insurance companies designed to shadow the original A and B parts of Medicare. It helps fill in the gaps. That's why we call them Medigap, because it does just as the name says. The gaps are things like your deductibles, your co-insurance, your out-of-pocket costs that Medicare doesn't pay 100% of your hospital and medical bills.
Right.
You often have some out-of-pocket costs to pay. So if you want help with those costs, a Medigap would be an appropriate idea for you to purchase.
In fact, do people assume that Medicare covers 100%?
Some people do, yes. And actually, it's not an uncommon misconception. So unfortunately, that's not the case, though. You do have out-of-pocket costs under Medicare, and a gap policy is best purchased when you are new to Medicare. Yes, when you are new to Medicare, you have a 6-month window to get enrolled in these supplement plans where you're guaranteed the right to purchase any policy, not refusing you because of age or health conditions.
Got it. That's worth repeating.
Yes.
That's good. So do it quickly. And now, the next couple slides, it's a little tricky to present this information just because there's so many out there. But suffice to say, there's plans A, B, C, D, F, G, K, L, M, and N.
Correct.
So the end, I'm going to go to the next slide, Medigap plan types. And basically, all Medigap policies cover a basic set of benefits.
Correct. So the plans A through N, as long as you're comparing the same alphabet letter, the benefit design is always the same. It has to be by federal law. Plan A is the most basic benefit. So Plan A is really going to cover the same benefits that are offered under any of the other policies as well. That's the most basic benefit design. The more basic the benefit, the lower the premium usually. The higher you get into the benefits, the higher the premium. You're paying more money for more benefits, basically. When we tell people about comparing and shopping for these Medigap supplement policies, we tell them the only difference is the company and the price that they're going to charge you. So as long as you're comparing one company's plan A to another company's plan A, the benefit is always the same. The only difference is the insurance company and the price that they're going to charge you. So
Interesting.
The hardest part of shopping for these supplement plans is basically finding out which of those plans A through N meets your medical needs, and then you're shopping for price. What you're looking for in companies is basically, does the company respond appropriately to me customer service-wise? When I call them on the phone, are they accessible? Do they answer my questions? Are they friendly? Is there an agent locally that I can go and talk to help me with my concerns? Those are all things that you're looking at when shopping for the company.
Now, and as you mentioned, each Medigap plan covers different benefits, and trying to capture this is a little difficult, but skilled nursing facility care co-insurance is covered by some plans at 50%, one plan at 75%, and so on. It's an alphabet soup here.
It is, and really there's a great supplement rate guide that the Medicare Information Office staff can help people access.
Oh, good.
There's a beautiful chart that kind of breaks all of this down a little easier. Some people may want to go with the Cadillac policy that pays everything at 100% regardless of the charge. Some people might want to go with a policy that has a high deductible, a dollar amount they have to meet out of pocket before the plan pays 100% of the remaining costs. And some plans, like these plans that show 50%, 75%, the plan may pay the remaining cost at those percentages until you reach a certain dollar amount and then pay 100% of the additional costs. Those different benefit designs can often lessen your monthly cost on the plan. So you really have to look at which of these plans meets my medical needs and what premium am I willing to pay for these different benefits. And that rate guide that's offered by the State Division of Insurance really kind of goes through that a little cleaner. And persons can find that online or contact my office and we can help them get a copy.
And there's even some Medigap plans that cover Medicare Part B and foreign travel emergency costs as well.
Correct. So you might have a plan that has a very basic benefit, and you might have a higher benefit plan that really covers all of your out-of-pocket costs after Medicare, as well as gets into those more specialized services like the skilled nursing. If you have a foreign travel emergency outside of the United States, there might be a benefit to help you with those costs.
So do you recommend, does everyone need a Medigap policy?
Not necessarily everyone needs a Medigap policy. This is not designed for persons who would have other insurance through a retirement plan that might supplement Medicare. If you access the VA as a veteran, Medicare doesn't cover services through the VA. So if you only exclusively went to the VA, you may not need a supplement plan. So no, not everybody needs a supplement plan. Also, if you're willing to pay the out-of-pocket costs through Medicare, if you pay the deductibles and the 20% that Medicare usually doesn't cover, there's no reason that you need to buy a supplement plan. But it's best to purchase when new to Medicare. You do definitely have to have the Part A hospital and Part B medical coverage to be able to purchase a Medigap plan. But it is a choice, and you do have to take action on your own if you want one.
I want to bring up how does a person find the right Medigap policy? And there's some resources here. Compare plans by computer or phone. People can visit medicare.gov. There's a Medigap comparison tool called Medicare. And as you have recommended, and I highly, highly recommend it as well, to call your office.
That's right. Any of those resources are great. Again, the Alaska Medicare Information Office is one-on-one counseling in your area, and we can help you access the Medigap rate guide that shows the different companies approved to sell policies in Alaska.
Let's very quickly talk about Medicare and the health insurance marketplace in the minute and a half we have left.
Okay. Medicare and the health insurance marketplace. The marketplace is where persons who are uninsured go to buy insurance. And persons with Medicare already have all of the essential health benefits that the marketplace would offer. So a person on Medicare does not need to purchase health insurance through the marketplace. In fact, it's illegal for the marketplace to sell people with Medicare a policy. So it is not something that persons with Medicare need to access.
And then there's Medicaid.
Medicaid is through the Division of Public Assistance. It helps people with their Medicare costs. There are also other programs like the Medicare Savings Program that can help a person with their Medicare Part B medical premiums. If persons have limited income and assets, they can call my office and we can help them access these programs and get the application. We say, when in doubt, fill it out. If you think you might be eligible, you could save money on your Medicare costs.
Very quickly, the Medicare Savings Program.
Medicare Savings Program is exclusively help with a person's Medicare Part B medical premiums. It is a little bit higher income allowed than the Medicaid program. So it's actually just exclusively help with the Medicare premiums.
Got it. And finally, Extra Help.
Extra Help is the program to help with Part D, prescription drug plan costs. Also, limited income and assets persons can contact us at the Medicare Information Office and we can easily help them apply by doing an application online.
Fantastic. I want to finally put your slide, your contact information up, including the Alaska Helpline and the general email address, and my thanks so much. I want to thank our guest, Jeanne Larson with Alaska's Medicare Information Office, for being our guest today. AARP is a nonprofit, nonpartisan member organization with more than 90,000 members in Alaska. AARP is dedicated to enhancing the quality of life for all as we age. We lead positive social change and deliver value to our members through information advocacy and service. Thank you for watching AARP Alaska.
Funding for AARP Alaska comes from the State of Alaska Division of Banking and Securities, Senior Citizen Support Services, and AARP.